Smart Chiropractor show, March 8th, 2022. Can you believe it? Well, on today's clinical conversation, we're going to take a look back to 2021. Did I say 2021? We're in 2022. We're going to take a look back to 2021 for Axis Clinical Conversations. This was a multi-day seminar that we held online with a variety of fantastic healthcare providers, chiropractors, non-chiropractors, showcasing clinical attributes. Now, one of the docs we had come on is a physician in Colorado, Dr. John Schultz, not a chiropractor, but he had an interesting presentation around MD and DC collaborations. So we wanted to share a few minutes of that presentation with you today. If you're somebody out there, and like most chiropractors that I know, have never built sustainable referral relationships with other healthcare providers, hopefully this clinical conversation from Axis 2021 inspires you to take the steps necessary to do so. Jason's the first person I heard say it this way: who has your patients in their practice? This is about compromise. This is not about compromising who you are. It's about connecting with those dance partners, those people that are already seeing more of your ideal patients in their practice, and winning together, and most of all, putting that patient first. So without further ado, here is our clinical collaboration video with Dr. John Schultz from Axis 2021. Hello and welcome to this next session at Axis Clinical Conversations. This is going to be an incredible session. We're talking all about MD and DC clinical collaborations. We have a special guest, Dr. John Schultz from Centeno-Schultz Clinic. Jason and I are, John, we're going to pepper you with a bunch of questions. We want to know more about your experience, your insight into how MDs and DCs can collaborate. This has been something I've been looking forward to a lot. How are you doing today, Dr. Schultz?
I'm great, and I want to personally thank both of you, Jeff and Jason, for this opportunity and the community at large. Thank you.
You are more than welcome. Jason, you're doing well today?
I'm doing great. I'm excited for this conversation. This is one of those long time coming kinds of things, and I'm really looking forward to what unfolds here today.
Awesome.
Absolutely.
So I brought up a slide, Dr. Schultz, and I'm going to say you have a laundry list of previous accomplishments, but I'd love to start back at the beginning. What got you interested in becoming a doctor in healthcare? Was it a personal experience? I'd love to know your origin story.
Yeah, well, thank you again for this. My origin, the very short story is I was in a car accident. I was thrown from a car. And actually was pinned underwater in a river and was drowning. And by the grace, I was saved. And my life changed after that. I was headed to law school. I was an English major. I had never taken any science ever. And the onus was on me to rethink, since I've been given that second opportunity, and I've never looked back.
That is super powerful, and that was news to me. I did not know that. That's super powerful. As I look through some of where you went to school, your postgraduate training, etc., I know along the way you sort of have charted a unique course, let's put it that way, in more interventional orthopedics. So how did that come about? It looks like everything started out, I'm going to say, in a relatively traditional doctoring path, and now you've really become, you and your partner Chris Centeno have really become the bearers of regenerative medicine, of orthobiologics. What initially piqued your interest with that, and how did that come about?
Yeah, so I'm a veteran of the United States Army. I was a staff physician at Fort Bragg, North Carolina, home in Special Forces. And it was those soldiers that were actually hurt. So my practice was anesthesia, but I also started doing chronic pain and pain for those soldiers that, through their service, were injured, both mentally and physically. So that actually spurred some of my interest. And then that little spark ignited a flame. That flame led to a second fellowship and then actually a practice in pain. But it didn't stop there, Jeff and Jason. What happened was we were very successful in a pain practice, but at the end of the day, we knew it wasn't working because what we were doing was utilizing medications, addicting medications, steroids, opioids, all the things that, the system had taught us, but we knew intrinsically weren't working. So that's what made us rethink, because we all have an obligation. And our obligation was to do the very, very best for our patients. And that's what, at the same time, in 2005, there was a paper by Dr. Saki that demonstrated the recreation or the regeneration of a disc. And from there, it's been a lot of late nights and long weekends. But that was 16 years ago.
John, I'm curious. I want to learn more, and I want others to learn more about this part before we go, deeper. Of, what was the aha moment, and or how did you make the switch? Meaning, there's, plenty of medical doctors. If you'll talk to them one-on-one, they know they're prescribing things that aren't as effective. They know they're offering injections that are palliative at best and maybe destructive at worst. And yet somehow the institutional momentum just keeps on going. It's almost as if, doctors find themselves sort of within a system they can't afford to get out of. And so they just, rack up so much debt and momentum and create lifestyles that are dependent on getting paid. How did you get out of the system and I'll say afford to tell the truth or have the courage to sort of not go with all of the institutional momentum that continues, the opioid crisis we're still dealing with?
Well, number one, we were fortunate in that we have a private practice. Okay. So we are not beholden to a large employer or a university system. And that's paramount. And number two, it was all about integrity. We would rather be lean and thin and drive that Volkswagen, but do well. Because it's the passion, it's that integrity that we knew deep down that this was the right thing. And when you do the right thing, when you speak the truth, the rest falls in place.
All right. That was our conversation with Dr. John Schultz. Fantastic gentleman, a fantastic doc, and really set the stage for how chiropractors and other healthcare providers can work together. Jason, what were some of your takeaways?
It was great to see that all medical doctors are not evil, like a lot of chiropractors seem to claim they are. It's just not true that there are medical doctors that see the light. And I just really commend this practice specifically as to their willingness to do the right thing, serve people based on their needs, not based on the system or the game or extracting out all the money they can get from the system. Because, hey, you know what? If I don't do it, somebody else will, and all the other rationalizations that, I guess continue to let this insane, backwards, corrupt healthcare system, sick care system go on. I mean, it's just what it is. Everybody knows it, and nobody does anything different. But when you see doctors who go, yeah, we were making plenty of money. It was easy because people come in expecting to get drugs. They don't expect to have a different recommendation that costs money out of their pocket versus covered by insurance. And on and on and on. It was just really refreshing. John's a great guy, and they just do great work, and they love chiropractors. It's a beautiful thing. So it's a pleasure to highlight them, and really refreshing to see that there are good people out there doing great work. And it was just wonderful. I loved listening to what they're up to.
I did as well. If you are watching and listening and you have built relationships, drop it down below. Give some insight for our other listeners in terms of how you went about the process. This is an area of untapped opportunity in my mind, but we're going to talk about it more than just today as the year goes on, because it is so important for us as chiropractors to reach as many people as possible. And we can't have shutters over our eyes. There are people that are visiting multiple different healthcare providers. And quite frankly, I don't care if it's an MD, a DO, a midwife, a doula, whatever their healthcare specialty. Your question that we're going to encourage you to think about over the next week is, who has your patients in their practice right now. Once you start identifying them, you'll be taking your first steps towards building those relationships. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.